Hey everyone, thanks for checking out my channel. In this video, I'm going to show you Pronator Teres Syndrome. What are some techniques you can do to resolve your symptoms at home? What is Pronator Teres Syndrome? Well, you may have Pronator Teres Syndrome and it look like carpal tunnel syndrome and it not be carpal tunnel syndrome. It's the same nerve. The median nerve that's compressed during carpal tunnel syndrome passes through the forearm here underneath the pronator muscle. The pronator muscle kind of sits across the forearm here. That nerve is going to travel down, go through the carpal tunnel, and supply sensation to the thumb, the index, the middle finger, and this side of your fourth finger. Now, a lot of times this is misdiagnosed as carpal tunnel syndrome. We use those braces. It just doesn't get better. There are a couple of tests you can do that I like to determine if you do have Pronator Teres Syndrome. The first is going to just be a compression test. So what you're going to do is go to that spot here over the pronator muscle where the median nerve is, and you're just going to compress. You're going to press down. You're going to hold that for about 30 seconds. If this reproduces your symptoms within your fingers and hand, then the test is positive. The other is going to be a Tenell's test. So we typically do this at the wrist. It's a tapping test. We do this at the wrist. You're going to come back here to the pronator area and you're going to tap and do the same thing. If you have reproduction of symptoms, then the test is positive. I do encourage you to test the other side. So test the unaffected arm and hand just to see if those symptoms or that presentation of reproduction of symptoms is normal for you. The first thing we're going to do is just a wrist flexor stretch. What you're going to do is extend the elbow out, bring the wrist down into extension and hold that for around 15 to 30 seconds, repeating that throughout the day. If that's too uncomfortable, if that really lights up your fingers, it's too uncomfortable, too painful, then what you can do is just keep the elbow bent a little bit and then go into your wrist extension. Or you can limit both wrist extension and elbow extension. So to maximally stretch this area, you're going into elbow extension and wrist extension both. But again, just kind of play with that a little bit and see what your tolerance level is, but perform that throughout the day. Our next stretch is going to be a wall stretch. I like this stretch because not only can you stretch the area, you can kind of load the joints and the tissue a little bit. That can have an effect on the nervous system. So what you're going to do is start with the wrist in extension, fingers pointing up, just holding that against the wall. And what I like to have my patients do is just kind of lean in. So I'm leaning into the wall a little bit, kind of encouraging that stretch. I can feel that tension, that load and weight going through my elbow, my wrist. I'm going to hold that. Now to make this stretch a little more difficult, you're going to go in and point the fingers back away. So my fingers are pointing away from me. I'm leaning into the wall a little bit, and while I'm leaning in, I'm going to turn away. Now I feel this stretch all the way down through my bicep, all the way down. I'm going to kind of turn away and hold this for around 15 to 30 seconds. This stretch you're going to perform throughout the day, several times a day. Next, we're going to perform a nerve flossing technique or nerve mobilization technique. There's a lot of these techniques as far as how to do them. This is just one of the easy ones that I like. It's pretty simple. It seems to work really well. So what you're going to do is you're going to flex the wrist, bring the fingers down, bend the elbow here, flex the elbow, and I'm going to lean away. So my left ear goes away from my hand and fingers here, or whatever side that it's on, you're just going to lean away from the affected side. I'm going to lean away, then I'm going to straighten out my elbow. As I straighten out my elbow and extend my wrist and fingers, I'm going to lean my head towards that side. So my right ear is going towards my right shoulder. And then we're just going to go back and forth. So I'm going to go back and forth with this, what's called nerve mobilization or nerve flossing or nerve sliding, just back and forth. And I repeat that for 2 to 3 sets of around 15 to 20 repetitions, or just maybe 10 to 15 repetitions throughout the day. Our next technique is going to be a myofascial release or a soft tissue release, kind of whatever you want to call it. And you're going to go into the area here, the pronator area here, all around the muscle. I have a thumb saver. We use this for massaging with our patients. You can purchase these online. I'll put a link in the description for one of these. You don't have to use one of these, but I do like it because just like in the name, it does kind of save your thumb. So what you're going to do is find that sensitive area here over the pronator, just past the elbow, and I'm going to hold pressure. And while I hold pressure, I'm going to press in. Maybe I'll hold that for around 10 to 15 seconds and relax. Then I kind of work down, hold in, another space here, 10 to 15 seconds and relax. You can even take this with a little lotion, work the whole area. Sometimes I have my patients just hold pressure and then work on going through wrist extension while they hold pressure going back and forth. It just does really well. A lot of times it helps to calm down some of the pain and the symptoms you're having. Our last 2 techniques are going to be strengthening exercises. So what you're going to do is take a dumbbell and you're going to grab the bottom of the dumbbell. Now initially we're going to say that everything's pretty flared up and it's painful, so let's grab right in the center of the dumbbell. So what you're going to do with this is we're going to rotate palm up over as far as you can. You're going to feel this stretch. It's going to stretch the pronator here. And then we're going to go palm down, back over, palm up, and then palm down, completing 2 to 3 sets of 10 to 12 repetitions. Now as the pain and the symptoms allow, you're going to grab this now at the bottom, and then we're going to flip palm up, really stretching this, and then go back over. If you don't have a dumbbell, you can actually use just a hammer, a regular hammer that you would use to hammer nails with. That works really well because you can kind of, the farther down the hammer that you hold on the handle, the more difficult it's going to be. So that's a really good technique to work on to strengthen the pronator. The next is going to be wrist flexion. So you can take that same dumbbell, and I have my forearm propped up here. I'm going to work on wrist flexion, just coming up, bringing my wrist into that movement there, completing 2 to 3 sets of 10 to 12 repetitions. A lot of times I have my patients go up and hold that, really tighten up this flexor mass here, hold that, and then slowly lower that down. Again, those are just 2 strengthening exercises to work on strengthening this area after you've done all your stretches and your soft tissue release work. Thanks so much for watching. I hope this video helps with your Pronator Teres Syndrome. Be sure and hit that subscribe button so you can stay up to date on all my content.